Hello, and welcome to another episode of me talking to a camera. I'm just kidding. Today we're going to talk a little bit about littles. And this is a very tricky area because one of the things that makes it difficult to, I guess, discipline and set up boundaries and rules with a little is because they have the idealism and the innocence of being a child with the intelligence of being an adult. When I first had to start dealing with A, getting to know my littles, and B, setting up those boundaries, it was very difficult because up until that point, they just came out whenever they needed to come out. And when I started setting up boundaries and saying, well, you have to ask for permission, then they would ask for permission and then come out anyway, whether the answer was yes or no. Then I had to set up boundaries and say, you have to wait for a yes or no. So they waited for a yes or no, and they still came out. But then I had to say, if it's yes, you can come out. If it's no, you can't come out. So it wasn't a quick process. It was setting up boundaries and enforcing those boundaries, and having people in your life also enforce those boundaries. For instance, Melissa will talk to them, but when she's ready for me to come back, she will ask for me to come back. And we've gained cooperation enough now that they will just say okay. So they'll go back in and they'll wait. What can we do as adults? Help littles understand that there is a difference between acceptable switching and not acceptable switching. Well, we can implore some of the other caretakers within the system to help teach and reinforce the rules, that they cannot just come out when they want to. There has to be strict guidelines and strict boundaries. There just has to be. Teaching a little is like teaching a child. They will push the envelope as far as they can go to test you, to see what they will push the envelope just to see how far they can take certain situations. Just like a child. The difference is, for the most part, littles will understand what they're doing, whereas a child is learning what they're doing. Big difference. My set of rules are going to be different from your set of rules because our lives are different. What I needed in my life is going to be different than what you needed in yours. So, sit down, really concentrate on what you need in your life, take notes, and then talk to your system about it. Whether they're listening or not, say it. The only way to get your system and get your littles to cooperate with the way things are now is to talk to them. And I know that sounds kind of obvious for the most part, but it isn't. It's not straightforward. It takes a lot of practice. Now, for infants are much harder. I had one in 97 and 98 who was just couldn't sit up, couldn't eat unassisted, and it was difficult to try to teach her all of these things. So the best way that we learned was to prevent her from switching. That took some coaxing of the older alters, especially Cassie and Kathy, who are primarily the caretakers. They basically had to take her and keep her away from the outside door, and to keep from the. It was a group effort to raise the infant. And they will not fully understand what's happening. Because unlike the littles, the infants work on a completely different ideology. They're babies. And when they're inside, when they're inside, they are infants. They're small and they're frail and they're very easily harmed. On the outside, there's a little bit more of a cushion because of our size as adults. So trying to differentiate between moving as an infant on the inside and moving as an infant in an adult body on the outside, that's difficult to muster for anybody. Ask your adult system to help you with the infant, to help age the infant. All systems will age their system differently. Everybody ages differently. I have some of my gang, like Theodore and Bella, Tori, and Delaney, Anastasia. They're littles. They've been littles since before I was, fully diagnosed, before I was even aware of them. And 20 years later, 22 years later, 23 years later, they're still littles. Force aging, let them do all of that on their own. Because as I learned, that can have some really bad side effects. I know this was a little scattered, but talking about the littles and how to help them be in this world with us is so much different than talking to an adult and trying to help them be in this world with us. It's all a learning process. There's a lot of learning curves. But understand your needs first. Understand where you need to be first. And then go from there. If you have any other questions, please feel free to ask them.